One of the things that I try to do is to be an active participant in the quality improvement efforts on all the specific departments within cardiology. I look at successes of one team and then try to introduce that to other departments so they can also be successful with that same initiative.
We're not totally there yet, but we're pretty close, and we're certainly a long ways away from where we were years ago. And it just, it becomes exciting to come into work and to work in a pleasant atmosphere.
You have to keep the meetings going. It's very easy to get so busy and want to cancel a meeting and move on to some other things that you have to take care of, but you have to keep that weekly meeting going to keep the momentum.
As we're focused on improving outcomes and people see that there's improvement, then they get satisfaction from their job, but that comes from engagement.
The quality of care or services that we provide to patients and family members, as well as internal and external customers, is extremely important. The quality improvement process is our system of checks and balances to help us gauge whether or not we are actually delivering the care and/or services that we want to provide and believe that we are providing. My advice to anyone who aspires to improve quality in their area is to incorporate it into their daily routine. Quality improvement is constant and should be among our highest priorities. Another recommendation is that you review data regularly and share it with your staff. One example of data that is common to most areas is the patient satisfaction survey reports. The information contained in these reports helps us to identify some of the things that we are doing well and some of the things that we need to improve. Highlight the response questions with the best scores where patients have indicated that your area does very well. Then praise the staff and encourage continued performance in that area. Show the staff the response questions with the lowest scores. These are the areas where patients are suggesting that improvements can be made. Solicit the staff's feedback for suggestions on what can be done to improve in these areas. For example, one of the questions on the medical practice patient satisfaction survey is about promptness in returning phone calls. A few quarters ago, one of our clinical areas scored low in this question. We shared the scores with the staff, discussed the current process, solicited recommendations for changes, implemented those changes, and monitored the survey results to see if our scores improved in that area. Fortunately for us, they did. As you embrace quality improvement, keep in mind that generally all of us want to do a good job. We come to work with the intentions of doing a good job in our designated areas. We also want to meet the needs of our customers, and the best way to know if we are doing a good job is to receive that feedback. However, feedback should be given in a constructive and supportive manner. Here's one final example that I'd like to share with you. It's also taken from the patient satisfaction survey, and it's the courtesy of the registration staff question. If your section scores low in this area, one way of dealing with this would be to show the scores to the staff and discuss the behaviors that might be perceived as unfriendly or discourteous. Give demonstrations of unfriendly versus friendly behaviors and discourteous versus courteous behaviors. Give your staff a view of what patients often see. Add a little fun to it. Then model friendly behavior and courteous behavior yourself as you encourage the staff to adopt those behaviors. Afterwards, watch those results skyrocket to new heights. Best of luck.